If you're thinking about taking melatonin for sleep, it's important to understand exactly what it is, how it works, what it can realistically do, and what the risks are, based on current medical evidence, not hype. Melatonin is a hormone your brain naturally produces in response to darkness. It's made by the pineal gland and plays a central role in regulating your circadian rhythm, your internal 24-hour body clock that controls when you feel awake and when you feel sleepy. In the United States, melatonin is sold over the counter as a dietary supplement, not as a prescription drug. That means it's widely available in pharmacies, grocery stores, and online, often in tablet, capsule, liquid, or gummy form. Because it's sold as a supplement, it is not regulated by the U.S. Food and Drug Administration, U.S. Food and Drug Administration, in the same way prescription medications are, which is an important point we'll come back to later. First, let's clarify something crucial. Melatonin is not a traditional sleeping pill. It does not sedate you or knock you out the way prescription sleep medications or sedative drugs do. Instead, melatonin works as a signaling hormone. When it gets dark in the evening, your body naturally increases melatonin production, which tells your brain that it's nighttime and helps prepare you for sleep. In the morning, light exposure suppresses melatonin production and signals your body to wake up. When you take melatonin as a supplement, you're essentially giving your body an external signal that it's time to sleep. This is why timing is often more important than dosage. Taking it at the wrong time can confuse your body clock instead of helping it. So what does research actually say about melatonin's effectiveness? According to the National Center for Complementary and Integrative Health, melatonin appears to be most helpful for certain sleep timing problems, especially those related to circadian rhythm disruptions. For example, people with delayed sleep phase disorder who naturally fall asleep very late and struggle to wake up in the morning may benefit from carefully timed melatonin use. It is also commonly used for jet lag. Studies suggest that when taken at the appropriate local bedtime after crossing multiple time zones, melatonin can reduce some symptoms of jet lag, such as difficulty falling asleep and daytime fatigue. However, it is not a miracle cure. Results vary from person to person. Melatonin may also help shift workers who have trouble sleeping during the day after working overnight shifts. That said, the evidence is mixed. While some people report improved daytime sleep, studies show that the overall improvement is often modest. For general insomnia, especially chronic insomnia, melatonin may slightly reduce the time it takes to fall asleep, typically by several minutes rather than hours. It may also modestly increase total sleep time. But it is not as powerful as prescription sleep medications, and it does not address all causes of insomnia, especially those related to anxiety, depression, chronic pain, or poor sleep habits. When it comes to dosage, more is not better. In fact, higher doses are more likely to cause side effects without improving effectiveness. Many experts recommend starting with a low dose, typically between 0.5 mg and 3 mg, taken about 30 to 90 minutes before your intended bedtime. Some people respond well to even smaller doses. In the US, you'll often see products labeled as 5 mg or even 10 mg per serving. But research suggests that these higher doses are usually unnecessary for most people. Because supplements are not strictly regulated, actual melatonin content in products can vary significantly from what's listed on the label. Some studies have found that certain products contain much more, or much less, melatonin than advertised. Let's talk about safety. For short-term use, melatonin is generally considered safe for most healthy adults. The Mayo Clinic reports that common side effects include headache, dizziness, nausea, and daytime drowsiness. Some people also experience vivid dreams or nightmares. Because melatonin can make you feel sleepy or groggy, you should avoid driving or operating heavy machinery after taking it. In rare cases, people report mood changes, irritability, or mild depression-like symptoms. If you notice unusual mood shifts, it's important to stop using it and consult a healthcare professional. One area where caution is especially important is long-term use. While short-term studies suggest melatonin is relatively safe, Long-term safety data, especially for daily use over many years, are limited. Researchers continue to study its long-term effects on hormones, metabolism, and overall health. This is particularly relevant because melatonin is a hormone, and hormones can have wide-ranging effects in the body. Although current evidence does not show major long-term harm in adults, the absence of evidence is not the same as proof of safety. That's why many healthcare providers recommend using the lowest effective dose for the shortest necessary duration. Another key issue is drug interactions. Melatonin can interact with certain medications. For example, it may enhance the effects of sedatives or sleep medications, increasing drowsiness. It can also interact with blood pressure medications and may slightly lower blood pressure on its own. People taking blood thinners should be cautious, as melatonin may potentially affect bleeding risk. Additionally, those on antidepressants or medications that influence serotonin levels should speak with a healthcare provider before using melatonin. If you have an autoimmune condition, seizure disorder, or major chronic illness, medical guidance is strongly recommended before starting any supplement. Special populations require extra caution. Pregnant or breastfeeding individuals should avoid melatonin unless specifically advised by a healthcare provider, since safety data are limited. Melatonin is also commonly given to children in the U.S., especially for sleep difficulties related to neurodevelopmental conditions. While some studies suggest short-term use may be helpful and relatively safe, pediatric dosing should always be guided by a healthcare professional. Recently, there has been concern about accidental ingestion of melatonin gummies by children, leading to increased calls to poison control centers. Because many melatonin products look and taste like candy, safe storage is essential. It's also important to understand that melatonin is not a cure for poor sleep habits. If you stay up late scrolling on your phone, drink caffeine in the evening, or maintain an inconsistent sleep schedule, melatonin may not overcome those habits. In fact, exposure to bright screens at night suppresses your body's natural melatonin production. Improving sleep hygiene, such as keeping a consistent bedtime, limiting screen use before bed, reducing late-night caffeine, and getting natural daylight exposure in the morning, can often improve sleep more effectively than supplements alone. Another common question is whether melatonin is addictive. Current evidence suggests that melatonin does not cause dependence in the way some prescription sleep medications can. People generally do not develop cravings for it, and stopping it does not typically produce withdrawal symptoms. However, some individuals may become psychologically reliant on it, feeling like they can't sleep without taking something. In such cases, focusing on behavioral sleep strategies may help rebuild confidence in natural sleep ability. You may also wonder whether melatonin is FDA approved. In the United States, melatonin is classified as a dietary supplement under the Dietary Supplement Health and Education Act. This means manufacturers are responsible for ensuring product safety, but they are not required to prove effectiveness before marketing. The U.S. Food and Drug Administration does not review supplements for safety and efficacy in the same way it does prescription or over-the-counter drugs. As a result, product quality can vary. Choosing brands that undergo third-party testing may reduce the risk of inaccurate labeling. So what's the bottom line? Melatonin can be a helpful tool for specific sleep timing issues like jet lag or delayed sleep phase, and it may slightly reduce the time it takes to fall asleep. It is generally safe for short-term use in healthy adults when taken at appropriate doses. However, it is not a powerful sedative, not a universal cure for insomnia, and not a replacement for healthy sleep habits. Higher doses do not necessarily mean better results, and long-term safety is still being studied. If you have medical conditions, take prescription medications, or plan to use melatonin regularly, consulting a healthcare provider is the safest approach. Before you take melatonin, make sure you understand why you're taking it, choose a low starting dose, pay attention to timing, and combine it with strong sleep hygiene practices. Used thoughtfully, melatonin can support better sleep, but like any supplement, it should be approached with informed caution rather than blind trust. If you found this explanation helpful, Like the video and subscribe for more clear, evidence-based medicine breakdowns. We simplify complex medications so you can understand how they really work.